and will have the perspective of the public, private and corporate schemes. Over to you, sir.
Good evening, ladies and gentlemen. Last session of the evening, I can probably see many tired faces, but the way day and night cricket is these days, last few overs are most interesting, and we'll try to do that. So, when I'm moderating this session with such an eminent panel, I have few advantages and few disadvantages. One is, I'm a medical doctor sitting here amongst the people who are specialists in insurance, and I'm at an advantage because I can always say I'm the least aware person around. So when a moderator is the least aware person, anything that he talks about, he's gaining the knowledge in that. My main job is establishing new healthcare institutions and also advising them on their administrative and the quality aspects. That's what I generally do. And as we started talking about it, this session, I have a question in my mind from where I would like to start and take it further. We are always talking of health insurance. The session that we are talking is emerging trends in healthcare and health insurance. But are we really delivering health insurance? The insurance we are talking is disease insurance, not health insurance. In fact, very recently, we were planning a healthcare institution in Gift City at Gandhinagar, which is supposed to be one of the modern cities that one is coming across. And we were supposed to design a hospital over there, healthcare institution over there. And I was making a presentation to Honorable Prime Minister. And we said that in this financial district, majority of the people who are going to be there, they are going to be young people. Do we need a hospital for them? Is their problem is disease management or is their problem health management? So why not create majority of the hospital as a wellness hospital or wellness center and only 30% of the hospital as a disease management center? So let people not fall sick and let them not disease. So my question starts from here that today where we are in the field of health insurance or is it disease insurance, whatever it is. Very rightly brought out in the last session, there is an absolute element of distrust. As the insurer, sir very rightly said, we are bleeding. You ask the customer, he himself said, the customer says, we are being cheated. You ask every hospital will be in some controversy with the TPA about the clearance of the bills. The insurer is not happy. The hospital is not happy. The customer is not happy. And still, all of us, we can't live without each other. So, I think let's start with this, that emerging trends from where we are today. And I've been very honored that I have a panel which probably will have answers to all this. And at the end of this, we'll try to keep ourselves in our own discussion for about 45 minutes, so that after that we can have at least 15-20 minutes of Q&A. So I'll request my panelists to please support me in that. So first, I'll request Shri Arindam Sen, Chief Operating Officer, JK Risk Managers and Insurance Brokers, to enlighten us that are we there where we are in a position to discuss where to go and the present status where we are.
See, today throughout the discussion, whatever discussion we had over the last 2-3 hours, the entire focus of the discussion primarily was on the product development or the scenario of the demography of the country or where we are at this point of time in terms of distribution. And that is where a major question comes in. Normally when we talk about emerging trends or new concepts, we talk about products, we talk about experimenting, but we are not talking about experimenting it on the distribution part of it. Distribution is something which definitely lacks today. And whatever we work out in terms of product, if we are not able to reach it to the customer, it is of no use. 2003 was when the broking fraternity was introduced and licensed in this country. And it took the regulator almost 14 years, 2003, almost 12 years, to come up with a proposed sub-broking model. It was only in 2015 that the regulator came forward and said, okay, a sub-broking model is allowed, which could help us in distribution, which could help us in taking this product to the rural part of the country. Now we talk about numbers, we talk about almost about 80% of the population not covered in this country. We talk about penetration of around 13% of RSBY in the rural area and 12% in the 13% in the urban area and 12% in the rural area. We talk about the government schemes and all, but we, as an industry as a whole, we don't get together and talk about any conclusive distribution model which could last and which could take the products to the customer, and that is a huge challenge.
Thank you so much, sir. I think you're right that ultimately, I give a lot of talks about hospital planning. Actually, I understand that subject more and hospital quality. And I always talk about a small statement from Sam Walton, the owner of Walmart. And he always says that it's the customer who's the king, who can open or close a store just by going to someone else. And it's a customer-centric knowledge and awareness, and ultimately how does the whole thing reach over there. I think that's what is most important. And I myself say that we being medical, we being probably relatively better qualified people, we are more aware, we are more understandable, or we understand the subjects better. But let's be honest, how many of us take a health insurance product because we understand it? It's just someone convinces us and we take it. If you ask me, am I adequately covered? I don't have an answer. And that's where probably a challenge lies, that everyone who has to understand it should understand it, and that would make the difference.
Just allow me to take it forward what Nandini was saying. The top two things that covers the insurance industry today is motor, and followed by the new trend that has come for crop. In both the cases, it is mandated. Why I say crop is mandated is that 99% of crop insurance is out of the financial distribution of the bank, and that is covered. So that is a mandated cover, and motor is also mandated cover.
Unfortunately, sir, I'm talking about health, because every one of us budgets for the motor, for crop, or whatever it is. We don't budget for the health. That's our own, and that's the fact of life. And now let me get back to the person who got the best applause when we got on the stage, Dr. Abhijit Chaturaj. And I've been told by Mr. Sethi when we were getting introduced that probably he's the most knowledgeable amongst us also on the subject. So I reach back to this, a simple question: where we are and where we are headed.
Thanks for the compliment. I don't know exactly whether I'm the most educated person or not. But coming back to the question, what drives health insurance in India? If I look at from the perspective of a customer, I can only say greed drives health insurance. It's greed which is writ large everywhere. And as a result, what has happened, you just said right now that I don't know whether I understand my health insurance policy or not. We have almost all the insurance policies are very complex policies. And health insurance is also a very complex policy. we have not been able to get out of the what we call the Queen's legacy. And we have policies which mentions herein, therein, thereafter, notwithstanding, and all these jargons making things very difficult to understand. Like sometimes we used only my health insurance students may understand, and some practitioners and professionals, condition precedent to contract or condition precedent to liability. Who are going to understand all these? Make the policy very simple so that people can understand it. This is the biggest challenge. Make the policy as simple as possible. Get away from the syndrome of Queen's legacy. Make it a policy which most of the people who buy it can understand. If you look at the other challenges, my entire PhD work was based on the rural areas, and I went to the rural districts of Satara and Pune. And I found people can buy policies. And I had taken away the population, which was essentially the BPL population. So roughly around 35% population I did not consider. I thought government will take care of. A population beyond that, they were willing to make payment of 2,000 rupees. And unfortunately, we found none of the insurance companies tried to rate them, thinking that that's a low ticket area. Now, a big segment which is willing to buy health insurance, and health insurance companies are not reaching to them. It is definitely a supply side problem, and this problem needs to be taken care of. And then if you want to really sell health insurance in any area, you have to take the health delivery mechanism closer to the people. Today what is happening? 50% of India's population has to travel around 100 kilometers to get some kind of treatment. And in that scenario, health insurance can never become popular. So what what insurance companies should be doing? The Rural Health Mission, before it was became National Health Mission, had a 3-tier system to for rural health care. So sub-centers, primary health care centers, and community health care centers. This was this 3-tier by which they used to reach the rural population. What health insurance companies can possibly do when we talk about PPP model? Well, start working with them, start rewarding them. Look at tell these hospitals, look, we will pay for our customers, and the paying mechanisms have to be a little different. Say I pay 100 rupees. What I request, look, 50% you can keep aside for infrastructure development, and rest 50% you can share with your employees. In that case, many health practitioners will go towards rural areas because there is a reward mechanism with it. So these are some of the ways you can really reach the rural population, and health insurance can become popular. And community participation is very important. If you look at the National Health Policy 2017, it also talks in terms of community participation. So if you if you work with the community, then possibly health insurance can become popular.
Thank you, sir. Thank you.